Thank you for coming back for the second part of Public Square. And Liz, I'd like to start with you. What are some of the legal issues they're facing that you guys deal with at Pegasus?
Well, the primary legal issue is that they don't have any legal authority initially when the children are placed with them. So they have trouble when they go to try to enroll kids in school, to get them health care, to get them mental health care. And we do have a program to help them get legal guardianship, and our program is funded primarily by the Aging and Long-Term Services Division. And we've been able to grow that program a little bit in recent years after the downturn, the economic downturn. So we're hopeful that we're not going to have the kind of waiting list that we've had in the past few years. But at this point, we still sometimes have to put our intake completely on hold and have grandparents and others waiting 3, 4, 5 months for our services.
What can happen in that time period where there's not kind of legal clarification?
Well, obviously what happens too many times is that the parents who are incapacitated by mental illness or substance abuse come back and say, I'm going to take my kids out of this situation, and there's really nothing the grandparents can do. They can call CYFD, but unless the grandparents can point to an immediate risk of substantial harm to the child, which often they can't because the child's been with them for a period of time, the kids end up back in that bad situation.
You bring up CYFD, and a House memorial was passed and signed earlier this year calling for the creation of a task force. What's happening with that?
Specifically, the 3 agencies that were named to coordinate that were CYFD, HSD, Human Services Department, and the Aging and Long-Term Services Department. Unfortunately, nobody was named as the lead, and I think that was the problem. So, you know, it's understandable when that happens, everybody sits around waiting for somebody else to do something. I'm hopeful that maybe with the help of some of the people here today, we can encourage them to get started on that so we can try to get something done before the date when we're supposed to be reporting back to the legislature in November.
I did ask CYFD to come on. They were unable to send anyone. I reached out to Aging and Long-Term Services and did not get someone from there, and I did not get a response from HSD, so they are not here with us today to talk about that. Senator Padilla, a memorial, you know, there's no money attached, but this was passed unanimously and signed, and hopefully, usually with memorials, things then move ahead?
Yeah, well, not necessarily. I mean,
Okay.
Some memorials, some programs do actually have funding that is made available through a separate appropriation if there's work to be done. I'll back you up, though, to 2014. I actually passed a joint memorial, and it was assigned to CYFD. It was a massive study of a lot of data, 27 data points. A lot of the information that I think would be, you know, brought to light for this secondary memorial that was passed this year, and that still has not been completed either.
You grew up and raised partially by your grandparents?
Yeah, I grew up in multiple foster homes, the All Faiths Receiving Home. My grandparents took us in. I'm the youngest of 5 children, and they took in 3 of us, and it was the best thing that ever happened to me, by the way. So the grandparents that are here today, I just want to say from the bottom of my heart, thank you, because I was raised by people that thought very differently than my contemporaries, and I think it's why I was able to grow out of that situation, build a business, create jobs, and actually get into a position of leadership on public policy, like the role that I have now. And I'll tell you, it cannot be easy for these grandparents. They're probably thinking, I'm going to go to Las Vegas and have a good time and go on a cruise, and you know. And I know that it was quite the hardship for my grandparents to take us in. I mean, they were already in their 60s, and they had 3 kids that they took in that were under 10 years old. And so I just want to say thank you. You're wonderful human beings, and I'm going to do what I can to keep driving this from a legislative standpoint, and I will see if I can help with getting this done. You know,
that would be wonderful.
Senator Boitano, you also know people who are who are raising their grandkids. This seems to cut across all strata of society right now, and it's curious. It seems to fly under the radar, though.
Well, first of all, to the grandparents raising grandkids, God bless you. And, Senator Padilla's success story is remarkable. And I'm sure every grandparent looks at someone like Senator Padilla and hopes and prays that their grandchild can see the same success that he's had. I think it's important to step back a little bit and look at this issue through a bigger lens. Government wants to look at the cause as well as the effect. So I think we need to kind of put the things and challenges you're facing into a bigger perspective. That said, also we have to be really cautious when we ask government to be involved. So a lot of business owners I know, a lot of families that I know say, listen, the less government is involved, the better. So I think we need to look at the problem through both of those lenses before we raise a question, what is it that government can do? What is it that children, youth, and families can do?
Well, I'm curious because, right, as I understand it, foster parents who really are doing similar kinds of work get some state support, right, and training, and it seems like those grandparents should be able to at least access that, and it sounds like they can't.
If you can become a certified foster caregiver, and that's whether you're a family member or a non-family member, I am a big fan of the foster children when they're picked up to go to a family member. So I had a bill this year, Senate Bill 23, which made it all the way to the House floor, and you know how that goes. And so got all the way to the House floor, and essentially it was 48 hours where a family member, primarily grandparents, they know what's going on in the home and they know what's going on with the kiddos, their kids and stuff. If they show up and appear and say, I will be happy to take my grandchild in or my nephew in or what have you, that they have basically the first right of refusal to get into the certification program. The home is immediately assessed to make sure it's a safe place for the child. If they begin the diagnostic check to make sure that they can be a certified family, then they are funded through the regular process like any other foster family.
I wanted to ask our grandparents what you think. Senator Boitano raises a good point as well, that there are, right now you guys are addressing some of this need through private funding, through the community, and I realize it's not meeting the whole need, but people don't always want CYFD involved in these issues.
I know there are grandparents who are just deathly afraid of CYFD involvement for anything. But I also know some grandparents who have benefited from CYFD involvement, me being one of them. My grandson was reported as being abused and neglected. If somebody showed up at my door, come on in, come see. Here's my grandson's room. You need to check the diaper? Okay, no problem. So it was unfounded. But through that, I found out because he is a special needs kid, he can get his own SSI. I didn't know that. That really helped get diapers. That really helped get, because I was working full time, my husband was disabled, and so we were just living just barely.
I think Irene's story is very emblematic of the system that we have in New Mexico. Somebody had to falsely report her for abuse and neglect before she learned about the services and the financial support that was available for her son. What we have in this state, unfortunately, is a system where with CYFD you're either out of the system and everybody's happy to be out of it, but you get no support and no help, or you're in the system, in which case you're looking at 2 years of the child in foster care and going through a very elaborate process. What I would like to see is that we change our child welfare system so that there are more services and supports out front before the children come into custody, starting with services and supports for those families who are identified early as needing help. And then if those families are not able to do it, if the child ends up with grandparents or other caregivers, that those caregivers get the services and supports that they need. And then we'd have fewer children in foster care. We have about 2,000 children in formal foster care at any time in this state, and a tremendous amount of resources, not to say that we couldn't use more, goes into supporting those children. There are 40,000 plus children who are living with grandparents and aunts and uncles and cousins and older spouses.
That
older
would be like
siblings.
informal
Informal
foster care.
foster care, or kinship care as we call it.
Well, the culture in New Mexico really is that the grandparents will, before the authorities are involved or before there's a church, group that might recognize that something's going on with this child, the grandparents just naturally take the children while the parents are going through whatever they're going through. And so that's just sort of a cultural thing. And then eventually, and I know in our case, in cases that I've seen, the grandparents basically just get fed up. And they're with their own children who are having problems with their grandchildren. So they end up reporting the parents. Then the parents end up, it's a weird cycle. Then the parents are the ones that end up reporting the grandparents. So the on-ramp to this whole cycle is, oh, well, let's not get the authorities involved. Let's try to keep this within the family. And then it spirals out of control after that once there's division between the parents and the grandparents.
Senator Boitano, do you see an option to, I guess, even getting started in that cycle?
The legal issues, I think, are huge. And if we can streamline the legal process for families that do want more legal authority over the children, I think that's definitely one route to go. The other thing is there are resources available already to the children through existing systems at school and whatnot if they qualify for Title I free and reduced lunch. So those are available already. Just understanding the system is a nightmare. And the advocacy groups understand the system, so they can do hand-holding and make them aware of different resources and that kind of things. There are grants available for those community groups. So in terms of funding, that's where I'd like to see the funding go initially and maybe expand from that point.
It also seems to be a need to just make information more available, or collaboration, which doesn't always require a lot of extra resources.
Put this information on 311. Have somebody at 311 have all this information for a grandparent to call and say, I just got my grandchild, what do I do, where do I go? And they can give them the resources. We don't have that.
Actually, my full-time regular job is building call centers. I built 311 for the city of Albuquerque in 2004, and we ran it for the first first 3 years. And it actually is already a part of the resource model there to take in services like what you've described and put it as a resource from 311. So I'll certainly take that up with them and work on it with them, but they actually have most of this information already. I think you hit the nail right on the head. Maybe that's what you were saying, Megan, but it really is a mechanism to build communication. The 33 counties in New Mexico do this type of work differently, yet we do have a state agency that's supposed to coordinate all of it. It just seems to me like we need a complete and thorough flushing of what's going on with CYFD and some standardized processes, some best practices, throw even maybe a Six Sigma project around it to where you're taking a look at what's really got the throughput that we desire with our tax dollars and to really help these kiddos.
One of the things too, I think, we need to think about is we're coming out of a great recession. So 2008, 2012, budgets were down, staffing on the state level was down significantly. So most state agencies are terribly understaffed. They're struggling to maintain what they already have on their plate. To bring additional missions to their plate is a challenge. So one way is to work through the legislature and put together a task force. You can do that in the private sectors. You guys do your own task force, bring your parties together, and then make recommendations to the legislature. You've got Senator Padilla, who knows more about this issue than anybody. Tell him, listen, X, Y, and Z is what I'd like you to do. So you just go past the whole idea of a legislative created task force. That might be an easier way for you to get to where you need to go.
I think that some of the people that are here could tell you that it is challenging to do that because you need leadership.
Yeah.
In this case, in this situation, Alicia has stepped up from MCH, and they've been very generous in funding her to do that. But these people have so much on their plates that they don't have the time to provide that leadership. So
I mean, they have been, but you're probably exhausted.
but they're,
Like, what other 20, I mean, we only get 24. That would be on my 25th hour.
Yeah.
And so we had, just getting to a support group is a challenge. Having a support group that might have food, so we don't have to feed the kids, that would be supreme.
And childcare.
And to have somebody take care of the kids, that would be supreme. And that's only to support ourselves.
Is there?
That's only to take care of ourselves, because we have issues too. We have to unload. A behavior therapist is not going to be there. It's going to be me.
You're the de facto counselor.
I'm the facilitator. I'm going, okay, well, that's
Who do you
an issue.
unload on?
I have a counselor through Allface.
What about leveraging more private sector support from the business community? Or go ahead, Elise.
Just wanted to share that I really have seen an amazing group effort come together. There is strength in this community. The awareness is being raised, and with the right voices and the right players, which I really feel like we've got many of those on board, I think we're on a really good path.
What I'd like to ask you is, at the conclusion of your conferences and seminars and summits and all of that stuff, give me the big 3 to 5, and I'll be happy to look at them as if they need to be legislative or funding or whatever, and try to help you through that through the legislature.
Delphinia and Patty, I mean, these grandparents are also saving the state some money by what they're doing. Yes?
If these kids were in state custody, there'd be a huge budget behind them, a huge cost to the state. And grandparents are doing it, because they're their grandkids.
What were you going to say, Sam?
We had a good experience with CYFD, and a lot of times I've come to defend CYFD. But during that time, though, I did notice that everybody deals with numbers, and CYFD deals with numbers. How many are in foster? How many were replaced back? And by not taking the grandparents that have taken their grandkids, the numbers look better for CYFD.
This is an issue that is really on the national stage as well. And one of the big issues that we're talking about is kinship diversion, which is this issue of kids coming to the attention of child welfare, and then with the agreement of the parents, the children are placed with grandparents, and there's a safety plan in place. We don't track that in New Mexico, and I think that's something, Senator Padilla, that we really need to get CYFD to do. Right now, the kids basically, I hate to use a negative term, but they get dumped with the grandparents. And once CYFD's investigation is closed, they're done. And the grandparents can't call them to ask for help. They can't, really get anything. So if we are going to do that, and I think it's being done at a very, very high rate in New Mexico, and I think it's great for kids to be with their grandparents instead of in foster care, but we need to do it in a smart way so that the grandparents are supported and the children get the supports they need so that placement can be successful. And so that's I think something that you could help us with.
Are there national models elsewhere that we can look at?
They're just starting to form. This issue, as I said, is really starting to percolate at the national level. California is putting in place a number of measures so that when children are placed, are diverted from foster care, that the agency has some responsibilities in terms of making sure that the grandparents get the legal authority that they need, that the children get the supports that they need, and frankly, that the parents get some help in figuring out what they need to do, some guidance in terms of what they need to do to be able to come back at a later date and resume their parental responsibilities.
And everything that was just described, I mean, the earlier that we can get on that, the better. I mean, we need to create an environment where folks are comfortable reporting what's going on. and don't feel like they're going to get in trouble or tossed in jail or whatever. The earliest the better, which goes all the way back to another topic that we've discussed along the way, which is early education and home intervention. And I know that's not the topic of today's discussion, but if we can focus on those first prenatal through age 5 years, the downstream benefits of the lower incarceration, lower domestic violence, lower child abuse, lower teen pregnancy, that's a real turn for the state of New Mexico. I know we have issues here and now, but if we can focus on that early education period, and the home visitation will actually shine a light on and expose some of these issues in the home earlier on.
And what we need is that connector. And that's why I'm so much in favor of having some sort of a case manager, because a lot of times grandparents are raising an infant and they don't know that there's all this early intervention support out there for them. And as Irene said, she went for how many years not knowing that she could have been getting some financial support from her grandson.
MCH Family Outreach does provide case management services to grandparents through our program, Grandparents as Parents program, GAP. And it does just that, but we only have 20 slots. Let's do the math. And our program is not something that you find. Our funding is all private, and so this is not the norm for case management services. And I'm pretty confident that, especially in Bernalillo County, you're not going to find anything like that for grandparents anywhere other than us.
Sam made a point about how the work you're doing as grandparents means that the state has to spend less money. I think that point's really, really important. Not only are you saving, the state money, but you are actually contributing in a positive way to welfare reduction and to poverty reduction in the state of New Mexico. And that's one of the arrows you need to have in your quiver when you talk to policymakers.
If we had one social worker for every 200 children in, say, a Title I free and reduced and the highest home foreclosure areas of the state, as an example, which is where a lot of this winds up happening, then there would be folks available to you through the school that'll identify that little Joey's having this challenge, and then marshal all of the resources that are not necessarily to provide counseling to that child, sit-down counseling, but financial assistance, or grandma needs help with this or whatever, or maybe it's not even the grandparent, it's an aunt that just needs a job to be able to raise the nephew or whatever. So that's another piece of the puzzle that could really help in some of these very high poverty areas here in New Mexico.
When you think about it, the school is the basis and should be the hub. But there are kids that are just coming up that, they don't have that. Well, hopefully early intervention, early childhood can identify the issues there. But we really need to have a hub. We really need to have something that can support our parents or our grandparents or whoever's taking care of those kiddos, because we need this stabilized environment for our children. And when you present challenges to me, that means less time for me to provide the calm, quiet, peaceful family life that I need to provide. Right now, I don't qualify for food stamps because even though I'm under poverty line, because I have 2 fixed incomes, for some reason I don't qualify. And that's not a big deal, but the thing is that how many other grandparents who are raising their grandchildren are in this same situation? They have 2 fixed incomes, and now for some reason, just recently, we're kicked off food stamps because of that. And so the other thing that becomes an issue is you go for help for HSD or Human Services or CYFD, and you don't get the same answer 2 times in a row. So there's a lot of communication that needs to happen, a lot of collaboration that needs to happen so that we can get our legs underneath these children.
we need the community to be more aware of this issue and aware of the ways in which they can support this population, so that when a grandparent goes to Income Support Division, they get accurate information about what benefits they're entitled to. When they go to school, they get accurate information about whether they can enroll the kids or not. That, I think, having a more kinship care friendly community would go a long way to support grandparents.
Well, thank
There's
you all
a
for
big
coming,
need.
sharing your voices with us here and coming and talking about it.
Thank you, Megan.
Thank you for inviting us.